my personal take on it is I think it's essential. I don't think we can do the job without it. That's my take on it. Whether we make it a requirement, as in you must, I think that's where the problem lies. Because, for example, I have sometimes trainees phoning me up from other colleges and saying, oh, I'm on this counselling course, I've got to come and do 20 hours or 10 hours or whatever it might be. Can, you know, A, can you come and see me, and B, do you do a discounted rate? Kind of like, and my first question is always, well, do you want personal therapy? And if they say no, then I say, then there's no point in you coming, because I'm not going to sit in a room with somebody just so they can tick a box, because that's a waste of their time and money, and a waste of my time too. If they want to come because they've got issues they want to work with, then fine. I think that's great. And I think most people, once they get into personal therapy, can actually see the benefits of it. And then, so coming back to should it be a requirement? So I think if we make it a requirement, as in you must, I think people go from an adapted place, as in, oh, well, I better go and be a good boy or be a good girl and, you know, go and see my therapist and get my box ticked, so to speak. And I think that's a waste of time, because they're not going to engage, they're not going to invest in the therapy process. And one of the examples I think I use in my book is, if you wanted to go to, if you went to see a doctor because you've got, I don't know, a skin problem, and you went to a doctor and or someone who purported to be a doctor, should I say, and they were sort of obese and had, you know, worse skin problems than you did, and, you know, were really looking quite unwell, and then they started telling you to drink more water and sort your skin problem out, you know, would you have much faith in their diagnosis? You know, because I guess it would be a little bit like, well, you don't seem to be doing what you're saying I should be doing.
Yeah.
So how can I actually take you seriously? So that's one part of it.
Yeah.
And then the flip of that is, if I, as a therapist, had a client in front of me that was talking about whatever issues they needed to resolve, and I was sitting there thinking, well, I haven't resolved my issues with my parents yet. How congruent and how ethical is that?
Yeah.
So I think there's something about, I do think it's essential, and I think it has to come from the integrity of the trainee, rather than being enforced, you must. Does that make sense?
Yeah, it really does. I mean, that's a powerful metaphor, the GP metaphor, I guess, the doctor metaphor, that how can we offer something to someone else or encourage someone to do something that we haven't engaged in ourselves?
No, and we're not prepared to do.
Yeah.
It's a bit difficult then, isn't it? So, you know, how authentic could we be in saying, well, to our clients, I mean, we don't tell our clients what to do, obviously, but you know, when we're making observations and so on, it's a bit hypocritical, isn't it? I think.
Yeah. So that really frames that it's essential to being a therapist. We have to have that experience of being a client. There's no two ways about it. And of course, when the student goes because they're being obedient or compliant to some rule, they're not really going to have therapy. That's it.
Well, probably not. No. And then, you know, and then what's that saying? No other profession, as far as I know, requires a trainee to have therapy. They don't.
Yeah.
So, you know, and having said all of that, I can see why it's a requirement.
Yeah. So there's a difficult tension in there. There's that. How can we kind of almost? It doesn't feel okay that people emerge into the field without that experience. But when it needs to come from the integrity of the trainee. Yeah, absolutely. Yeah.
And I think, sorry.
No, and you go, Cathy. Sorry.
Well, I was going to say, and the other bit of that too, of course, is that if a trainee does go in an adapted way to therapy to tick the box,
Yeah.
then I think it's also the integrity of the therapist to challenge that and say, well, actually, no, we're not going to do that. I'm not going to sit in a room with you to tick a box. I'll sit in a room with you to work with you. And I think that's a very important piece too. Because if you think about it from a different frame, if, there I am sitting in my therapy room and I've got someone who comes into me saying, oh, I'm just about to embark on a 4-year psychotherapy programme. The UKCP say I've got to have 40 sessions a year for a minimum of 4 years and throughout my training. If I was a bit of a dodgy therapist, shall we say, then I might go, ka-ching!
Yes.
That's very nice, thanks very much.
Mm-hmm.
I don't think that's okay either. So it's, I think obviously therapists with integrity will say, well, that's not kind of how it works.
Yeah. So there can be real vested interests, I guess, for the therapist to have a long-term client, for the training organisations. So it's like everybody needs to stay rooted in their place of integrity, I guess.
I think it's essential. Yeah.
And a responsibility for the training organisation to kind of help the trainee to use the therapy or to enter therapy at the right time, or
yes.
Have you got some thoughts about that?
Well, again, I think it depends upon the course requirements and the accreditation requirements. So, for example, the BACP don't require anyone to have had personal therapy in order to gain BACP accreditation. Whereas the UKCP, particularly the Humanistic and Integrative Psychotherapy College, they do have that requirement that I mentioned before, the 40 hours a year for 4 years. So I think training establishments have a responsibility to inform the trainee at the beginning if there are any requirements and if they are what they are, and if their own accrediting or qualifying body has any requirements. So somebody might be doing a counselling course that is not, for example, BACP accredited or UKCP, leading to UKCP registration, but it might be part of the course requirements that the trainee completes so many hours of personal therapy. So I think the training establishment needs to tell people all of those things, of what the different requirements are. And then also for trainers on the training course to be proactive and encourage trainees to have personal therapy, because as a trainer it just comes out in the process, doesn't it?
Yes.
Of training.
Yeah.
And so I think trainers have a responsibility too in saying, this whatever it is that the trainee is struggling with, maybe they could do with some personal therapy to help them.
Yeah. And that's such an important responsibility as a trainer. I know in the Temenos course we don't have that requirement for personal therapy, but we know that at some point that's going to be an essential part of the experience. And
it is.
I know, and of course some people come in our training who have already got a large experience of personal therapy, so they might need something quite different to someone who hasn't.
Yeah, exactly.
But I think
I think that's why. I think that's why requirements are so rigid. So quite a few people come into training as a result of their personal therapy.
Yeah.
So they've been in therapy for 5 years, 40 hours per year, and so on. So then to start training and then be told, oh, you've got to do another 4 years of 40 hours. It's like, well, what about the 5 years I've just done?
Yeah.
So I think, again, that's why, requirements can be too rigid. I think we have to take the person as a whole, what else have they done in their life? As we were talking about earlier on, people can have a wealth of life experience and, they might not have a first degree. So should that mean that they're not allowed to do psychotherapy training? That's bonkers, in my opinion.
Yes. Well, I agree very strongly. So, yeah. And of course, I'm sure there are other views too.
Oh, I'm
but
sure.
Yeah, but that makes sense to me. And I really like how you write about this topic in your book, like, because it's so important for trainers and training organisations not to sleepwalk through these processes with students. It has to be a really contactful, switched on process, or at least that's what you really encourage in the book.
It is.